Hi everyone, Wynn Brown here with our bi-weekly President's Update. Jamie Ledger is with me today from IT as my co-host, and happy to have you here with me to update everybody on some things going on around the hospital and around the health system. But maybe first you just want to tell people, everybody knows you're in IT, but people might not know what you do in IT.
Well, thank you for having me first. I'm happy to be here. Like you said, my name is Jamie Ledger, and I am an IT engineer. And what that means is I'm sort of responsible for the large-scale projects that kind of keep the hospital going to the future for technology. So an example of that is one of the projects I'm currently working on with my current colleagues is a large-scale network upgrade. So we're going to all the facilities and we're upgrading all of the hardware. We're getting better wireless in all these facilities, and we're getting redundancy in these areas. And this is in preparation for Meditech Expand. So that's a lot of what I do on a day-to-day basis, kind of large-scale projects.
So when we go live with Meditech in 10 months, the system can support what we're doing.
It's going to be nice.
We have an older system, we do, and older equipment, and so we're getting everything in order.
Yeah, and outside of that, I'm involved in some of these committees to try to work on some of the items that came up in last year. So I worked on the Tiger team for the care values, and I also worked on a Tiger team for the parking, and I was also a heart trainer. So I was lucky enough to really be involved with trying to get all of these things that came from the last survey into the light.
So tell me, what did you think about your role as a heart trainer, and now I guess we refer to you as a sustainer?
Correct, yes. So it was an awesome experience. I don't know if you remember, but it was actually a birthday wish of mine to be a heart trainer. I've actually been in customer service for 15 years, and I really saw a need for the hospital, and I felt like I wanted to be a part of the change of the customer service and the culture. So we had roughly 90 or more classes I
didn't realize it was 90.
90.
And they're ongoing now because all new employees get trained twice a month. We have training, right?
So everybody coming into new orientation, we train those folks as they come in. But we had a huge effort, and just so proud of the organization, everybody that came in and took a class. So proud of all of the trainers that taught these 90 classes, and really impressed with the changes that I've seen here in the culture. It's just, I feel like I get more smiles, I get more friendly conversations for people I don't know. I think it's been a real improvement to our culture here. Right. I'm so proud to be a part of that.
Right, and from a data point, when we look at, that's how we feel the culture, but we also look at our patient complaints that come in. You know, we track all those, and we are demonstrably on a downward trend. That's awesome. That definitely speaks that our culture is resonating with our customers and our patients, so that they're having a better experience, and I think we're having a better experience. So one of the things that we did just do is we just completed our biannual employee engagement survey.
Yes.
So we hit 71%. Our goal was 70. So thank you, everybody. That is a goal that actually our board of trustees sets for us, is to hit the 70th percentile. We just have some raw data back right now, and we're going to have Preskini's going to come in January and present to departments on the scores, groups of departments, so they can see. We're going to break it down. And then we're going to invite the heart trainers and the President's Advisory Council for a session to hear firsthand, because we want to take the new data and the new feedback we have, give it to the President's Advisory Council, just like we've done previously. That's how the President's Advisory Council came to be. And then tackle what are the top items to make this an even better place to work. So we actually moved 12 points up on the scale, which is incredible for us. That's incredible movement, statistically significant improvement in patient engagement satisfaction. We'll share more about that as we get the data and are trained to talk about it in January, but you'll get a first-hand glimpse in January, because you're not only a heart trainer, but you're President's Advisory Council. You're a man for all seasons here, so appreciate that.
I can't wait to get to work on everything that everybody has said, so I can't wait.
Now, I think you did have some sort of challenge.
I did, yeah.
To get people to participate.
Yeah, so everybody has various means of why they want to do something, and there was a funny idea I had that people seem to like. So if we had 75%, which we were just short of, I was going to shave my head or beard in the style they're choosing, and I will tell you that I do not.
Because I have right here, we could actually, I think it's even plugged in. We could do maybe a little grooming here right now and then. Maybe for later tonight at the holiday
okay,
party.
sounds good.
Okay, we'll put that away for now.
So even though we didn't quite hit the 75%, I did have a side bet with Athol folks. So I was in charge of team 3 to try to get participation from my team, and I had a direct challenge with the folks at Athol that we were going to have a better percentage of participation. And it was back and forth, but Athol did beat us out. So for that, I will be going to the holiday party tonight in a Scottish kilt. So feel free to come find me, laugh at me.
Maybe photo ops with everybody.
Oh, absolutely. Take a photo with me. So that, good job, Athol.
Thank you,
Please
Athol.
find me at the party tonight. Happy to have a picture with you.
Okay, so you're ready for the party. I hope I think we have over 320, I think, people.
Awesome.
25 people coming tonight. So that really kind of is the capacity of the Colonial Hotel.
Yeah.
So that we'll have a great vibe. We'll have a great celebration, and we've had a solid year. We're off to a solid start as well.
That's great.
And so, we just need to keep that momentum and be strong on all fronts, especially as we prepare for Elmer go live. Also tonight, our new CFO arrives and gets introduced to us. Mike Abatello is coming to the holiday party tonight, and on Monday he starts full time.
Wow.
So we're very excited to have him. So hopefully everybody get a chance to meet him tonight. He's coming to the Heywood party, and then we'll get him out to all the rest of our locations as well.
So something that we just recently undertook, the Joint Commission, which was a huge undertaking. Can you tell me a little bit about that and how that went?
Sure. So we had prepared for the Joint Commission's arrival. We had 2 mock surveys. Dana Gerard was our leader for the Joint Commission this time around, obviously supported by a great team of clinicians and support to do that. So we were well prepared for them. We've had I've been here 9 years. I think our best Joint Commission survey that I have seen.
Wow.
We improved about 26% over the prior. They're not coming back to recertify or revisit anything. We are in great shape. Facilities was standout, and that's a place where they always try to ding us. We did very, very, very well, and I'm very proud of the team, and I think that just speaks to the quality of care and the commitment that everybody at Heywood has to make sure that we're one of the best community hospitals in the country. I want to thank you for coming in today. Glad to give everybody a holiday update. I hope you all have a safe, wonderful, healthy holiday and look forward to a great new year. We've got some amazing things in store at Heywood, and I'm glad we're all along together for the ride. So thank you very much, my friend. Take care. Happy holidays, everybody.
Happy holidays.